queens, sisters manifesting their dreams. Get your cream by any means and beam with self-esteem. For the queens, sisters manifesting their dreams. Get your cream by any means and beam with self-esteem. Beauty supreme and Buddha walk so mean. The way you fit in them jeans, you eat your cornbread and greens. Dance or a doctor, red wine or vodka. Redesign your spot and redefine your mantra. Retwist your locks and realign your chakras. Doing your squats and getting closer to God, huh? Brunching with your squad or taking a girl's trip. Adjust your crown, you God's gift to the world, sis. Celestial body, drink your water. Meditate, sun-kissed goddess, heavenly order. Levitate, tribe of Ashanti, black girl magic, melanin popping, whether you ratchet or lavish, whether you bougie or savage, you a gift and a treasure. You got to love a black girl getting a shift together. Black girls are getting a shift together. These black girls getting a shift together, man. These black girls are getting a shift together. These black girls getting a shift together, dog.
Hello, everyone, and welcome to Black Girls Getting Their Shift Together. This is a podcast about mental health and wellness, as well as self-empowerment for Black women. I'll help you chase that fire that you have from within. My name is Ursula, and I'm your host each week, and I'll deliver relevant topics and resources that affect our community. Just remember, once we can identify the problem is when we can start to heal. And welcome to season 2. Thank you for returning. This is going to be an interesting topic today because getting your shift together also means being informed. And not only being informed, but being informed from the professionals. Period. Hello, Rochelle Wheeler. So I am going to read a bio with my lovely guest who is in the waiting room right now. She has an extensive bio, but I'm not going to read all of it, but I'm going to read most of it because I want you all to know my guest is fully capable and fully informed about this COVID vaccination. So we're going to get right into it. I have the lovely Dr. Sandra Ford in the waiting room, but first let me give you a little bio about her. Dr. Ford has been the District Health Director of Dekalb County Board of Health since February 2005. She oversees clinical and populations-based for almost 800,000 residents here in Dekalb County. And for those who do not know about Dekalb County or Fulton County, these are counties that are in or the outskirts, suburbs of Atlanta, Georgia. In the USA, because I have global listeners now. So she oversees she has oversight of programs such as emergency preparedness, environmental health, and refugee health. And under her leadership, the DeKalb County Board of Health has received over $40 million in grant funding to address obesity, physical activity, nutrition, asthma, and smoking cessation. While Dr. Ford currently serves as the District Health Director of DeKalb County, she also served as the Interim Director of Health for Fulton County from 2019 to 2020 during the COVID-19 pandemic. Her valuable knowledge and expertise were essential when facing the COVID-19 crisis, as she was instrumental in ensuring the safety of the citizens of DeKalb and Fulton County simultaneously. That is very impressive. A few more things of many. She's also served as the acting director of the Georgia Division of Public Health to oversee the agency's reorganization since July 20. I didn't know that, since 2009. Very cool. She is also a board certified pediatrician. She received her bachelor's degree from psychology from Stanford University, a medical degree from Howard University College of Medicine, and a master's degree in business administration with a focus in health services administration from Howard University's Grad School of Business. Dr. Ford speaks multiple languages, and her dedication to minority health and health inequities have led to her appearances on CNN, CNN International, and local Atlanta stations, including Fox, ABC, CBS, NBC, and public broadcasting radio. Her focus includes bioterrorism, health disparities, infant mortality, asthma, obesity, and nutrition. I'm going to bring this lovely woman on right now. I want you all to say hello to the lovely Dr. Sandra Ford.
Good.
Did I leave anything out in your bio?
That's plenty. That was a lot. Yeah, other than the fact that I don't sleep very much, but other than that, no, I think it's pretty comprehensive.
Well, reading that bio, I wouldn't get much sleep either, but I do really want to thank you, like I mentioned earlier, for coming on and agreeing during your busy schedule amidst this global pandemic. But you look like us, and I want to share this gem with everyone that you know what's going on. You are the perfect person. So anybody, I want you to just chime in, say hello. Hey, Tiff, say hello. If you have questions about the COVID vaccination, please put it in the comments. I will read it. And I do have some questions, Dr. Ford, from other listeners who had inboxed me. But before we get started, when anyone hears my voice, I'm going to say, this is me talking. This episode does not give you a pass to slide up in Dr. Ford's DM. She's got enough going on. So if you need to make an appointment to get the vaccination, I'm saying this, please, I will put the Dekalb County's Board of Health, I will put their website in the show notes. But please, the sister is busy. She's helping her
tired.
Tired. Let her do her job. She has a phenomenal staff to get these appointments. So let her staff do that and let the sister do her job and get some rest. So with that being said, I just had to put that asterisk in there.
Appreciate you.
I can only imagine. And also, please keep the questions specific to the COVID vaccination. All right, let's get into it because I know you're at work. COVID vaccination. What has been your response? Like from what you're hearing from people, are people wanting to get it? Are they hesitant?
So I think from where I sit, I've seen much more demand than fear. And so it worries me when media outlets talk about vaccine hesitancy as the reason why we're not getting this vaccine into the Black community specifically, because I've not seen a lot of that. Of course, there are a few people like, oh, I'm not getting that. But I think for the most part, I've seen people really anxious to get this vaccine, particularly our seniors.
Really?
Yes.
Well, what about people in our age demographic, our population?
Well, right now they're not even a priority category, so they would not even be eligible to receive vaccine unless they were healthcare providers or first responders. But I will say, yeah, the interest decreases a little bit. It really depends on what's going on in your specific environment. For example, my mom is in a facility, so, I'm going to be the first in line to get a vaccine. Do you know what I mean? Because I want to be able to see her. And as a healthcare provider. But, if you have a situation where your risk of infecting someone else is high, then you would be more interested in receiving the vaccine, I think. But unfortunately, we still even have healthcare providers who are not interested in vaccine. And that's really disappointing because the science behind this is very sound.
Interesting. I will admit I've been that person hesitant on getting it, but because of what I do for a living, it is definitely necessary for sure. And what would Based on our history as Black people, I can understand the hesitancy of getting it, and that has been mine. But that's why I wanted to have this forum, and also to let people know this episode is not to have anybody. Oh, David Manuel just said, "Howdy, Dr. Ford."
Hey, David.
Hey, David. But this episode is not to push anyone to get the vaccine, and it's not, hey, David, and it's not to discourage anyone from getting the vaccination. This is just informational purposes only. Dr. Ford, what are the ingredients in the COVID vaccination?
So there are 2 COVID vaccines right now. And it's so funny because we scientists always know the names of these vaccines, but it's so funny to me that this is now common, Moderna, Pfizer, everybody knows the different types. But there's 2 types of vaccine, for COVID, Moderna's vaccine and Pfizer's vaccine. Both are created with messenger RNA, which is a way of replicating the antibodies that stop the virus from being spread. That's the simplest way to put it. Both are 2-dose series because that first dose is like the primer for your body to sort of let it know that, okay, we're about to do something different here in terms of protection. And then that second dose is what locks in the antibody response. That's why the efficacy of these 2 vaccines is so high. It's very rare to see a new vaccine with rates 93, 95% effective. That is really impressive because your flu vaccine that you get every year, if you get a 65, 60% effective vaccine, you're doing really well. So to have something that's 93 to 95% effective is huge. And, the way they created this is that it obviously it tricks the cells so that, it gets in there and creates the antibody response.
Do you suggest that people, I have 2 questions. Do you suggest that people get the antibody test first, or does it matter?
No, the antibody test just means whether or not you've had a COVID infection. If you've had a recent COVID infection, you shouldn't get the vaccine until you have fully recovered from the virus. So you would need to wait a little while anyway. So antibody response, they're not related. It wouldn't be, because some people were saying you had to have a negative test to get the vaccine. We're not doing all that. We just want to get people immunized.
Right. So with Moderna and Pfizer, is one better than the other, or one more effective, or does it matter?
I mean, they're so close. They're so close in efficacy that it really doesn't matter for the general public. From our perspective, the Pfizer vaccine is a little more of a challenge because vaccines have to be refrigerated, but the Pfizer vaccine has to be in ultra cold storage, like minus 70, I think. And so we had to buy a special refrigerator to store it. And so when you're doing kind of traveling or outreach, that's a challenge because you've got to keep that thing in a certain temperature. And so for Pfizer, we tend to give Pfizer in-house where we can control the temperature better. So you won't see Pfizer for the Board of Health, at least, at an outreach event, unless we bring the freezer, and it's just a little bit more complicated to distribute. But in terms of efficacy, they're both very similar. What I need people to know is that they were both tested in African American populations, in Latino populations. So that's important to know because a lot of medications, when we talk a lot about clinical trials, and people, you have to make sure that your clinical trial is done in a demographic that reflects your community. And so you want to make sure that these medications are tested in Black folks, white folks, Asians, Latinos. Also, they did the Pfizer vaccines and the Moderna vaccine in people with hypertension, diabetes, because we want to make sure that these things don't impact the ability of the vaccine to function. So I was very impressed when I read the whole profile, like, who did you test this on? What did they have? What was the age range? And both vaccines did a very broad, 30 or 40,000 people so far, and they're still, still evaluating, people. So that made me feel better.
Right.
Also, believe it's the Pfizer. It's either the Pfizer or the Moderna. Was and developed in part by a African American scientist, Kizzy Corbett. And while we say it shouldn't matter, it does.
It
It does. It does
absolutely
matter.
matters.
It does matter. And
It
so
matters.
it
Hmm.
matters a lot. And so, that made me feel better, because I feel like we're going to make sure that we are covered. And so, you know, anything that has an impact globally, that means the brightest and best minds in the world are going to contribute to developing this, because it's an economic impact. I mean, we literally have shut the world down. And so
Yeah.
everyone has a vested interest in getting us back to whatever normal looks like. So everybody contributed to the development of these vaccines, and it was a race, but everybody's using the same data and technology. So it's just that Pfizer and Moderna got there first.
Okay, Pfizer and Moderna. Moderna. Who's paying for this? I don't know if I should ask that, but who's paying for the
No, it's a
vaccination?
good question. These are government funded vaccinations based on the impact globally that this pandemic has created. So they are providing the vaccines at no cost. We are asking for insurance, just to offset, the administration fee, but we have never, if you don't have it, you don't have it. We don't make a big deal out of it. In fact, we just recently even started to collect insurance data because, it's like, okay, we probably need to at least pay for these nurses. But yeah, it's not, it's everything has been at no cost to the Board of Health. So that's very helpful because we don't want money to be a rate limiting step. We already have the issues with manpower administering the vaccine. And so we don't want to have to pay for the vaccine on top of it.
Right. Have you known of any bootleg places that you've heard of that are administering this vaccination? And if not, or so, where can people go to get this vaccination?
So that's actually a good question because so when the vaccines first, when we learned, okay, we've got this vaccine, it's been approved, there's going to be a rollout, the state of Georgia posted, hey, if you want to be a vaccine provider, sign up with us. We'll get your CLIA license, whatever, and we will provide you with vaccine. And so there's two types of providers. There are private providers and public providers. Emory, for example, is a private provider. So Emory provides vaccine to Emory staff and Emory's patients exclusively.
Oh,
Public providers are like us. We give it to everybody. Dekalb only had, other than the Board of Health, which obviously we're mandated to be a public provider, we only had two other people who agreed to be public providers. One was a pediatric practice, and right now we're not immunizing children, so that wasn't very helpful. And the other is a very small organization that could probably do no more than 50 vaccines a day. And so that's why we're happy now that the Krogers and the Publix and the Ingles have jumped on board, because up until then, we were it for general public
that's
to
a
receive
lot.
that. Yeah,
That's a
so
heavy overload. Wow.
it's overwhelming. And so what we've done now is on our website, which is www.dekalbhealth.net, we have an opportunity for you to sign up with us, which right now is very limited because we're receiving vaccine in very small allocations right now, honestly. But we also have provided links to other sites where you can try to get vaccine at the Publix and the Krogers and all of that. Now, as far as bootleg goes, there have been, and we've seen on the news, instances where folks have stolen vaccine. Stolen vaccine, tried to sell it.
What?
Yeah, there was a volunteer arrested in one of the metro counties, a volunteer clinician who had pocketed 20 doses. And so now I'm like, okay, now I got to make sure that folks aren't stealing vaccine. Is this what we're doing now? But it really speaks to the demand, for vaccine. And so that's why I'm happy you said what you said about don't contact me directly. I don't have a conduit I don't keep it in my trunk. Don't email me, don't Facebook me, don't LinkedIn me, because it's a fair process. It has to be equitable. And it can't be because you called and made a big stink and okay, fine, I gave it to you, because there's too many people waiting.
Exactly. And to be honest, I don't want to go to my local flea market and seeing it being distributed.
Say it again. I lost you for a minute.
I don't want to go to my local flea market and seeing the vaccine being distributed.
Right. I got that. I got that vaccine. Right. 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 So, I wondered, like, the people who stole it, like, how are you going to administer? Like, well, because you still got to get the second dose. So, I mean, how are you going to do that? So, I don't know. I mean, it just speaks to the desperation of people to get this vaccine. So, we talk about vaccine hesitancy. I'm really not seeing that. I'm seeing more of the opposite.
Right. I have a question from Monica Johnson. Hey, beautiful.
Allergies.
First, no worries. She said, "Thank you, Ursula and Dr. Ford. Here's her question. If you're taking questions, I am Monica. She wanted to know, how often would we have to take the vaccine? Is it like a flu vaccine yearly, or once and one and done?"
This is the $1,000,000 question. We're waiting to see. This is new. This is a new drug. We got an emergency use authorization for both of these vaccines, which means we're still learning about them. But the situation with the pandemic was such that, the authorities agreed to go ahead and move forward based on the safety profile, but we're still learning about length of time. We do know that it's at least longer than COVID immunity, which is anywhere between 3 months and 12 weeks ish. So it's at least longer than that. And so we're hoping that it is a long-term solution, which would be awesome. Like, measles that you only get, once or twice, or it may be a flu kind of thing, because COVID is more similar to influenza than a measles or a mumps, where you would only need to get the vaccine, every however many years as a booster. So probably it may end up being an annual thing, but we won't know that for sure for a while.
Mm-hmm. So there's a person and they have their appointment, just say next week, to get the vaccination,
Yes.
or 2 months from now. What can they do in the meantime to protect themselves from COVID other than sheltering in place? They have to go to work. Like myself, people
Right.
who know me know I'm in the dental field. What can I do? What can others do to protect themselves in the meantime?
So let me say this, because I think that people think that once they get this vaccine, they can go out and about and do whatever. And that is not the case. Even after you receive the COVID vaccine, you still need to adhere to the guidelines around wearing your mask, watching your distance, and washing your hands. I mean, that hasn't changed, because what one of the things the COVID vaccines do is that they will decrease the likelihood that if you are unlucky enough to get COVID, that you're going to get seriously ill. But what it doesn't do is necessarily prevent you from infecting somebody else. So you still need to wear your mask and those same things. If you're still touching on folk and not socially distancing, you can still pass this on. And particularly since we're still not quite sure how long this coverage lasts, you would still want to be doing those things.
So what if they already had COVID? Should they still get the vaccination?
It depends on how long ago they had the COVID. If they had the virus within 90 days, then you probably still have some immunity. But if you've had it a few months ago, or if you had it at the early onset back in the summertime, yeah, you need to think about getting the vaccine, because we have seen evidence of reinfection. So, you would want to think about, yes, which would be the worst. I can't even imagine getting that twice. But, we've seen it. And so given that, folks who have had COVID definitely need to be considered about, getting it again, particularly if you're in that 65 or older category where we're currently immunizing.
I just received a text, and I know this person, they don't want to be disclosed, so I won't say their name. They just told me that their uncle had COVID 3 times.
See?
Oh, and the 3rd time is when he passed away from it. Damn.
So you're not hearing a lot about that on the news, which is troubling, because it It is a people get the flu more than once in a season. So, I mean, I don't think that has bubbled up enough that just, because some people are like, oh, I already had it. It's like, it doesn't really work like that. So folks still have
Mm,
to be careful, especially if you're medically fragile. So I'm
yeah,
sorry to hear that. I've heard twice, but I've never heard 3 times.
yeah, wow. What if someone has to, how far should they wait between a flu vaccination and a COVID vaccination? Because,
You need to wait 2 weeks between any vaccination. So if you get your flu shot, your shingle shot, your pneumonia shot, any of those, you need to give a 2 week spacing in between that and your COVID vaccine.
wow. Are there any side effects from the vaccination?
That is the $1,000,000 question. I wish people would be more transparent about that, because I think that's part of the problem. It's just like when people say, oh, I took the flu vaccine and I got the flu. You didn't get the flu. What you got is the immune response from the vaccine. And so 2 doses. So dose 1 for COVID, mostly what people are complaining about is that it hurts. So if you get the shot, your arm is sore pretty much for the rest of the day. And so we let people know that. Um, Dose 2 tends to have a little bit more side effects. Like you may have a little flu-y kind of symptom. You may have a little bit of a fever. Again, this is because the immune response is getting generated, because that first dose was the primer. The second dose is the dose that kicks in the immune response. So you're going to have more symptoms. So people who are getting dose 2, we usually suggest you get that toward the end of the week. So if you have, if you feel bad, at least you're home relaxing. If you are at work, then you have a couple of days to kind of get yourself together without feeling like you have to report to work. So it's those two that people seem to have more of a challenge with, but people don't share that. And so when people get that second dose, like, oh, I got dose 2 and I was sick as a dog. Yeah, well, okay, that's supposed to happen. That's part of your immune response. And so we need to warn people about that so that they don't panic.
And I would be that person to panic if I get that second dosage.
I see it all over Facebook. Oh my God, I can't move. I'm so sick. Okay, but yeah, I suppose it's kind of expected, but we don't talk about it. And so people are, freaked out when it happens.
Yeah, that would be me, because I will automatically think I have a fever. Oh my God, I have COVID. I took the vaccination for no reason. I got COVID. Yeah.
And these are not live viruses. These are not live vaccines. And so you cannot get COVID from the vaccine because there's nothing live in it.
Live meaning it's not viable, or what do you
Well,
mean by
it's not like, let's see, like chickenpox. I think the chickenpox vaccine is a live virus. So, you might be able to contract chickenpox from the vaccine very rarely, but these are killed. So it's like the flu vaccine. That's why you can't get the flu from the flu vaccine, because it's killed. It's nothing in there that would give you the actual virus.
Personal question. You don't have to answer. How do you feel that the United States, in their distribution of this vaccination, how would you grade us?
So, it's tough because I don't know what the plan was. I know that for our area, it's been a challenge because the allocations are very sporadic. We don't know from week to week what we're going to get. And so it's a challenge to plan. Last week, we had 100 doses. That's an hour's worth of work for us. That's not, that's not going to do anything. This week, we got.
Did you say 100?
100.
In Dekalb County.
Right. And we do 1,000 doses a day. So literally, when I say that was an hour's worth of work, it's not even really an hour. We can get rid of that in 30 minutes, probably. This week, I think so far we've gotten 1,000 doses. That's one day's worth of vaccine for us. And so when you've got a whole, thousands of people waiting for dose 1, and I have a commitment to making sure that the people we've already immunized get their full series, that just means that it's going to take you a lot longer to start your series, because I have to finish the people who have already had dose 1. So this is where, the challenge comes in. And so I just got a call this morning from a legislator that was concerned about, what's your outreach to the Black community? I don't have vaccine. I can only do what I can do. And so if I don't have to have an outreach event that would target specific vulnerable populations, I need at least 5,000 vaccines
Oh my
because I
God.
need to have a supply for the population that wants to sign up online, but I also need to have a separate supply for the churches and, the other folks who might want to have events in their community.
Mhm.
So, and right now at 100 doses a week, that's not going to happen. It can't happen right now. I mean, we are ready when we get more vaccine, but I can't plan anything until I have a supply.
So you have a patient who had the vaccination January 1, right? The first series, and they're ready for the second dose, but for whatever reason they can't get in, just say until April 1st. Would they have to take the first vaccine, the first series again, or does it stay in you? Like, is there a time slot where they have to get it done?
Well, we're saying so. Okay, so for Moderna, the second dose is due 28 days after the first dose, and for Pfizer, the second dose is due 21 days after the first dose. What CDC has been saying, though, is you can stretch that out as much as 6 weeks, but no one yet has said you need to repeat the series if you can't get in. What we're doing, if we gave you your first set of immunizations and you can't get an appointment, then you should call the call center or reach out directly, and you will be scheduled. We were providing second appointments for after the first dose, but not until January 13th. Or January 11th, the Monday. So everybody who got vaccines after that should have been scheduled for their second appointment at the time that they got their first appointment. Those first group of people, we got vaccine, our first doses came December 29th. So
Mm-hmm.
the first people we immunized were staff, and healthcare workers. So the folks that got immunized in early January were not scheduled for their second dose at that time because we didn't know how much vaccine we were going to get. So I don't want to schedule you 4 weeks out and then I got to call you and say, yeah, I don't have vaccine. So we were like, okay, we'll call you when we get vaccine. So that's what we're trying to do now is catch up on those first 2 weeks and make sure that those people who had dose one got scheduled for dose two. But it was, it's about 3,000 or 4,000 people. So
Oof.
we need to get them through the pipeline. I think it's down to maybe 2,000 at this point because we've scheduled some folks. But at 100 doses a week, this is what we're dealing with, is trying to make sure that we cover those people who already started the series so that they're fully immunized, and then we'll focus on the other groups.
Wow,
It's a lot.
it's a lot.
And I need people to understand that because we have been accused of paying favorites and you all are holding. I have nothing. Everything that we have, we're pushing out into the community as equitably as possible.
Absolutely. And we thank you for all that you do for DeKalb and Fulton counties and just everything you do, because this is a lot. I mean, I'm listening to you and I'm feeling some anxiety coming just because I feel that feeling of lack. Like,
well, it's a lot of pressure. Luckily, I've been just focused on DeKalb since May, so now I'm happily just back down to one job, which is good. But it's a lot. It's almost 1 million people here, and if you really talk about like CDC and the VA and all that, in Emory, we have easily over 1 million people here during the day. So,
wow.
And, the vaccine is available to all Georgians. So it's not like you have to respect your district. So if you work here, you're going to come here to get your vaccine because it's closer to your job. And so we got to figure all that out. DeKalb has a huge refugee population. How do we reach out to people that are non-English speakers? How do we reach out to the handicapped and the homebound and the bedridden? How do we reach out to the homeless folks? I mean, so it's just, this is what like is in my head all day, every day. And so any question that anyone has asked me about how I'm going to do this, I've already asked myself. So, we're just trying to work it out.
It's interesting that you mentioned the homeless because when I drive to work, I see the tent city, and I always think about, oh my God, I'll have masks. I'll give them, of course, I cannot give a vaccination, but I feel like I'm always moved to give masks out, and I do. But I always thought, what is the fate of the homeless people? Because they're human, they're just like us. And it breaks my heart, even talking about it now. It's so sad. And I'm just
Now, let
wondering,
me tell you something interesting about the homeless community, though. The homeless community, when we tested them, they had the lowest rates of COVID from everybody because they're isolated. They're isolated. They're not out and about. They stay in their, little, groups. And it was so surprising to me because we would do like mass testing events, specifically targeting shelters and, areas where we knew they were, congregate one of the lowest rates. It was amazing. Plus they're
amazing.
outside. They're outside, so they were less likely. I mean, it was really interesting because we thought that they would be, these huge numbers, high percentage. Not so much.
That really makes me feel better. It does,
I
because
mean,
it breaks.
they have a whole host of other needs now. Let me just say that, and they would still be on the priority to be immunized for sure. But yeah, surprisingly, their positivity rates were nowhere near what we were expecting.
We both are in a fitness community and know a lot of mutual workout friends. And Chelsea Cannon said hello, by the way.
Hey, Chelsea.
Cute self.
I know I should have had to do my makeup before I got.
I know, me too. Sorry, Chelsea. This is some dollar store lipstick right here.
Oh, this is pure fatigue. Nothing.
Well, you wear your fatigue very well because I know you are working overtime. But because we are in the same fitness community, what's your opinion about working out outdoors? Yeah, because I love to ride my bike. I've sacrificed playing racquetball. I'm too scared to go inside of any gym that we go to.
Right.
And what's your opinion about outdoor working out?
So part of your forum has to do with mental health.
Mm-hmm.
And I think that in this time of such extreme levels of stress, you have got to figure out an outlet, whatever that looks like, obviously in a safe environment. I have a walking buddy I walk with at dark 30 every morning. We were out this morning and she was like, "Is that snow?" But it's like, we just bundle up and get it going. So, I've got that. There's online things. I finally broke down and invested in a Peloton. No plug for Peloton, but probably one of the greatest because they have a meditation app. And so, there are times when I don't necessarily feel like working out, but I just need somebody to take me down a couple of levels. And last night I took a peace meditation for 10 minutes. And I was like, okay. Yeah, I feel better now. So, you've got to figure out, especially because we are so isolated, you've got to figure out, we talked about the COVID-20 and everybody's gaining weight because they're sitting in the house and eating because they're bored and they're working from home. So you don't want to trade one issue for another issue. So we've got to figure out a way to continue to be active for here and for here.
Absolutely. Is it safe to work outdoors?
Yes. As long as you maintain your distance and, if you're around people you're unfamiliar with, you of course always mask up. But, biking, your emotions. So, you're not going to be coming into contact with folks like that. I think biking is one of the great things. And, when we walk, I see people walking, they nod, they keep going right past you, so it's not like you have exposure for any lengthy amount of time.
Right.
Gyms, my son is a gym rat. And so, I send him with everything, wipe down every single surface, hand sanitizer, the whole bit, but he also tries to go at the crack of dawn before anyone else gets there, so people have to adjust, their behavior accordingly. And just be mindful that everybody is not as safe as you are. And so sometimes people are just careless, and it drives me crazy when I see people out with no masks on or not wiping down surfaces or sneezing and touching something else. So you got to take your own evaluation of the level of safety. Personally, I'm a home person. I'd rather be in my own equipment, my own weights, my own whatever, so I don't have to worry about sanitizing everything when I touch it.
I have a two-part question. One, would it be safe for me to go back into the racquetball court and play?
The problem with the racquetball court is that it's enclosed. You know, it's so tight in there. And so and you're breathing heavily, you're running back and forth. So not so much. Playing like, if you did, till you went outside, but then that's not racquetball. I just
Yeah.
think that, also with racquetball, because you're running back and forth, you're crisscrossing each other. God forbid you collide. It's just,
Yeah. And it
sorry.
happens.
I'm Dr. No for most things these days. I'm like, yeah, no, that's not a good idea.
Look, interview over.
It's true. No one ever asked me anything because I'm always like, yeah, no, don't do that. No. So.
Second part of my question. I heard you give the politically correct answer. But what is your real opinion about you see people out here living their best lives during this COVID era?
No, it's not politically correct at all. It's infuriating. And I am that person that will tell you. I was at some food place and the guy had his mask down here. I said, and I told the manager, I said, first of all, I run the health department, so don't make me come back here in an official capacity. But his mask needs to be over his face because he's preparing food.
Mm-hmm.
And when I see you do this, like, no, we're not doing that. So, I am that person that will say something, and
sister.
but in a respectful way. Hi, just, you need to pull that because sometimes people are unaware. But sometimes people are just jerks. And at a certain point, if I see that you and your group of people all are choosing to not wear a mask, I will remove myself from that situation because I'm like, okay, well, y'all want to be like that. Well, I'm going to go over here, because at once it becomes a crowd issue, I'm not going to police a whole bunch of people or, I will tell the manager or point it out, and hate to say it, but sometimes throwing that health, when I pop that card out, it's like, okay, what are we going to do here? You want to
hear
but
something?
It's infuriating to me because it is so disrespectful of just everyone. And people talk about civil liberties, but your civil liberties do not allow you to make other people sick and put other people at risk. That's not what civil liberties are.
Right. I was in the store over the summer and it was a small store. And I said, oh, there's not many cars. I'm going to just run in and run out. So while I'm looking for the items, the store started getting crowded. And so my anxiety, people who know me, they know my anxiety is very high when it comes to COVID. And so we're waiting in line and the guy next to me, he didn't have anything on. And I said it. I said, so you're just not going to wear a mask at all? Well, actually, I asked the manager at the desk, and he's like, well, no, we don't require it. So that's when I turned to the man. I said, so you just going to not wear it? He said, oh, I had COVID a couple months ago. I'm fine.
And see, that's where the education piece, that's why I wish that these repeat infections were publicized more because people think it's one and done. Just like they'll say, oh, I had my immunization. Okay, but that doesn't mean anything, So it's frustrating. And it's so funny because for me, I feel like I'm naked when I don't have a mask on, I was out walking and I had just planned to just walk. And then I realized I need to go grab something from the store. And I was like, oh, I have a mask. And there was like, it's so sad. It was like a T-Mobile store next door. And I knocked on the window. I was like, can I have one of those masks? Because I got to run to the store. And of course, now I got to buy a phone because I walked in. But, it's just to me that sense of, and that's how you should be. To me, I feel the same way when I get in a car and I don't have my seatbelt on.
Yes,
it's instinctive. Like it's just a click. I feel very anxious when I don't have a seatbelt on, and I feel like that's how people should feel right now when they don't have a mask on. It should
It's
feel
funny you
odd to
said that.
you.
Yeah, it does feel odd because I always have a mask. And this just happened 2 weeks ago. I went into the liquor store and I just, for the first time ever, I literally forgot to I never forget. And when I realized, I was like, oh my God, I still got my bottle of rum, but it was just get in and get out. Forget the chaser. You'll figure it out at home. I could not walk around the store. And I remember feeling the anxiety in my neck, and it was just too much. But I did have a good drink later on that evening. Still.
So, well, and that's something to talk about too, because alcohol consumption has gone up dramatically while we've been in lockdown, but also so has domestic violence, because people are having a really hard time coping with this. And so I am very mindful of, we say stay in the house, but you've got to have some kind of connection, because it's dangerous to be isolated for just extended amounts of time without any human interaction. And so you got to figure out a way to balance. And I get this all the time because people are like, well, you're out. I'm never reckless. I'm very careful. And I have a bubble of folks that I've been with literally since March. And that bubble stays very tight. And it's so funny because when we see other people like try to get in the bubble, we live, like I said, we move away. Because like, okay, I'll know you. I know them. But you've got to have a healthy balance of social interactions for your mental health while not being careless with your personal health.
Absolutely. Absolutely. Going back to the domestic violence, someone we both know who is on the SWAT team, you think about it.
Mm-hmm.
I ran into him in the store and he said the same thing about the domestic violence, and that he's been working a lot during his SWAT hours.
Well, and what we're also concerned about, that's my birthday twin, by the way, but what we're also concerned about is the kids, because the teachers are the ones that pick up a lot of the child abuse. And so if you're not going to school, then who's checking on the bruises and those cuts and the scrapes? And so, adults may be reporting domestic violence, but we're certain that we're also probably seeing a lot of unreported child abuse and sexual abuse too, because now you've got, you may have to come into the office, but you're leaving your child in the hands of somebody else, or an older sibling, or another person in the neighborhood or whatever. And there's just a lot of stuff probably we're assuming that's going on that's not being reported right now, which is really problematic. So this has had a toll on so many different levels globally. It's really, that's why I'm like, thank God for a vaccine. Let's just get done with this.
Yeah, yes. It is a trickle down effect. And if you're a teacher and you're listening, please put your name in the comments so we can congratulate you.
Yes, God bless you all. This is I
have a lot of friends.
And the mothers and the parents who are trying to teach children remotely. Yeah. I mean, that's not everybody's skill set. And I'm a patient person. I would sit down with my son. Plus, I love math, so I'm like, okay, let's do this. Now, when you come for the once he started getting in the higher grades, I'm like, yeah, you're on your own, pal. But if I had to, I don't know what I would do, because it's just not. I don't have that skill set. So, trying to do that and manage, if you are teleworking, how do you balance your child's school day and your teleworking requirements? My son is in college. I think about my job right now, especially when I was doing Dekalb and Fulton, and I was like, how could I have done that with an 8-year-old?
Oh my God.
How would that have happened? I would have had to send him to my folks, which would have broken my heart,
Absolutely.
But, it's like there's no way I can manage that level of responsibility and be homeschooling a 4th grader. So, it's a challenge. So shouts out to the teachers, shouts out to the stay-at-home parents, because this is no joke. It's extremely stressful.
couple more questions and then we're going to get off. So, because I know you're at work. Joan Basket has a question. She said, is the first and second dose made up of the same makeup, or is the second dose different?
No, same vaccine.
Same vaccine.
It's just that the first dose is the primer and the second dose is kind of just kicks it in a little bit more. So it's like kind of like, I call it like the door opener, the first one, and the second one comes on in. So yeah, but same vaccine.
Okay. All right. A few more questions. What about someone who is pregnant? She wanted to know, is the COVID vaccine safe for her to get while she's pregnant and she wants, or she's going to breastfeed her baby? What are the effects of that?
So the challenge with pregnant women is that pregnant women do not participate in clinical trials for obvious reasons. So this vaccine has not been tested on pregnant women. However, the American College of Obstetrics and Gynecologists say that it is okay to receive in pregnancy, particularly if you are a healthcare worker where your risk of exposure to COVID would be greater. So I don't say yes or no specifically. That's really a doctor conversation because it depends on your level of risk. And the same about breastfeeding, because there have been no studies on this vaccine in breastfeeding women. So that's a conversation between you and your OBGYN based on what you do and what your level of risk is.
What about it? What if they have a serious underlying medical condition outside of high blood pressure or?
Well, it depends on what that is. If you have, for example, like a cancer, I mean, you those are the people you want to protect. And I'm hoping that their category comes up soon in terms of immunizations, because, we want to make sure that folks that are vulnerable like that with compromised immune systems have access to this vaccine. And there were some folks that had cancer that participated in clinical trials. So we do know that it works for them as well.
Wow. Yeah. I wonder if you can get chemotherapy and COVID vaccination at the same time.
Apparently, there's no risk for that. It's a different, chemotherapy kills cells. The vaccine creates an antibody. So there's two different processes.
Interesting. So I heard you say earlier how when you get the second dose of the vaccination, how you'll have some conditions, but have you noted anyone that have a severe allergic reaction? And what if someone, like I've heard someone say, which was interesting, that she possibly, or her physician said that she could possibly have Bell's palsy as a severe allergic reaction. What are your opinions?
They've spoken about that because that came up in the clinical trials, but we're talking about, I think, like 30,000 people participating in the trial, and 3 people got Bell's palsy.
Oh.
So that's probably the prevalence in the natural community. So there was no direct correlation between the vaccine and the Bell's palsy. Now, allergic reactions, if you have allergies to foods, that's not a risk for having a problem. Right. If you have had an allergic reaction to a previous vaccine, you need to be observed more closely. Because generally when we are providing vaccine to everyone, we have everyone sit for 15 minutes so we could observe them and make sure they're fine. But if you've had a history of an allergic reaction, then we would watch you for 30 minutes to make sure everything's okay. And we have, crash kits, crash parts right there at the site, but we've not had a single negative event, and we've distributed about 15,000 vaccines so far.
Really? Well, if someone did have a severe allergic reaction, well, what should they do? Should they go to their doctor? Do they just wait it out? And
well, your reaction would be probably in that first few minutes, which is why we are there to observe you. If it was, severe enough where you were having respiratory issues, we would give you an EpiPen. We would give you some epinephrine or salumedrol, a steroid to calm things down. And if really got bad, we call medical transport. We're in Dekalb, so we're the hospital every 5 blocks. So, or fire and rescue. Because we do have we have the National Guard there. We have sometimes we have paramedics that volunteer. So and there's clinicians at the site. There's nurses and docs. So
wow. What about dialysis patients? Do they have them tested when they come in? Since most dialysis patients have to be dialyzed 3 times a week for hours at a time. What's your opinion on that?
Do they have them tested for COVID?
Yes.
I'm not sure. I would imagine so. Or they are, masked up and, shielded up or whatever to make sure that they're not, vulnerable. And I'm sure that in the dialysis unit that they are spaced very widely apart. I'm sure there's the appointments are spaced such that there's not a whole crowd of folk in there at one time,
Right.
that they're just socially distancing.
Interesting. So we're going to wrap it up, but what about people, before we get off, what about people who are qualified and they want to volunteer and help? Is there a link for that, or how would they go about that, or is it allowed?
Well, we have very much been looking for volunteers. In fact, last month, my sorority, Delta Sigma Theta Sorority Incorporated, it was Founders Day. And so they called me a few days before, the week before, and said, hey, we want to do a community service event. Did you know that there are over 150 clinicians at Grady that are sorors? And I was like, what? Okay, well, let's do something. So we had an event at one of the senior centers, which was great because it is in an African-American community that we know for sure, was not going to have access to vaccine. And so they volunteered and we did 500 vaccines that day.
Oh, wow.
So we are, and it started me thinking, and I was like, wow, if every group from the Divine Nine gave me 15 or 10 doctors, we could immunize probably 10,000 people a day, if we had vaccine. So what I'm starting to do now is at least recruit people so that when we get vaccine, I can say, okay, we've got 60 volunteers, let's have an event. So that's kind of what we're doing. So we do have on our website where it's additionally that you could volunteer. You have to do a 5-minute immunization review. Have to come in and get done. General volunteers, there's also, you can help with traffic control. We need help with the call center because a lot of our seniors are not computer savvy. And so they're having problems accessing appointments online, or they may not even have computers. And so we need more people to make appointments for people. There's lots of things.
So we are having technical difficulties. Sandra, she's going to log back in, but I don't know what everyone has heard so far, but there are volunteer opportunities if you want to get involved with the COVID vaccination process. And when she comes back on, here she comes. When she comes back on, what we're going to do, it's okay, Sandra, I'm going to bring you out of the waiting room in a minute. I will have her website to the Public Health, Dekalb County Public Health, so that you can get that information because there's strength in numbers. So that's what we need to come together as a community. Remember, it's bigger than our little bubble. It's literally the world. So we need to do our part on it. Monica, I do see your question, and Sandra is coming back on soon. Sandra, can you hear me? Can you hear me, love?
Yes.
Okay, because you're still frozen, but we're going to work with it. Monica wanted to know how soon can someone start working out after 14-day quarantine after COVID?
It depends on how you feel. Some people worked out during quarantine. It depends. Some people have very mild symptoms, runny nose, whatever. So it's your personal preference. Clearly, if you're having a cough, you need to take it easy. But I'm always a big proponent of exercise. You know,
Yeah, I know you are.
within moderation.
And speaking of gym, I want to give Monica of NPS, Naturally Persistent Fitness, a huge shout out because I follow her on her social media. She has her gym immaculate. You can see everybody wearing masks, the shields, I should say, and they're still getting it in. So shout out to her and any other fitness gym owners that are keeping up and making sure that physically we're still getting it in, and mentally we do need that. So Monica, thank you for all you do for our community as well. So,
Right, and that's why I didn't want to say an absolutely no to gym workouts, because it's really just a matter of how safe your fellow worker, gym people are, and how safe they keep the actual environment. So
yeah, she gets it in. She gets it
that's
in.
good.
I love it. Well, we are going to wrap it up. I just want to thank you so much for coming on, for taking time out of your busy day, your busy year to help the community. And I definitely would love to get involved on the mental health part of it. I know we'll talk offline, but I'm all for it because this is a lot going
It's a
on.
lot.
It's a lot. It's a lot.
It's
But
a lot for us. It's a very stressful
yeah,
time.
but really thank you from all of us at Dekalb County and Bolton, just all of us. You're wonderful and a gem to us.
Thank you.
Thank
All
you,
right.
everyone. Have a good day, Dr. Ford, and stay healthy.
Thank you. Bye, you guys.
Take care. Bye.
Take care.
All right. That was informative. Dr. Sandra Ford is wonderful. And just like I started the show, I'm going to end the show and say, if you need to get in contact, go through the website. Please do not bombard her with more. She's got a lot more than she's even saying. She has a lot going on. And we need to have our frontline workers healthy, mentally, physically, everything, so that they can help serve us in the community. Thank you, Rochelle. It was a great session. You know what? While I have everyone on, I'm going to announce February challenge. If you want to hear about the challenge, put me in the comments. So the February challenge, for some of you who do not know, I used to teach spin classes, and we used to have so much fun, and we would have themes and challenges. So this is a challenge. This February challenge, we're going to go week by week, so you need to stay tuned. It's all about, okay, Rochelle, I'll tell you, sis, it's all about decluttering. Yes, if you declutter your mind, if you declutter your home, your car, anything, once you declutter and it clears up space and it opens up, you can start to declutter your mind. I never believed that, but it does work. I promise you. So, hey, Ed. Oh, I got Ed on here. If you want to, no, Ed, I'll get to you in a second. I'm going to put a pin in it. So back to the challenge. Just stay on board with Black Girls Getting Their Shift Together, or on my personal page or on my Instagram page, all under the same name. And each week we're going to go through a series. So, and I also have someone coming on who is a professional home organizer. So it can be anywhere from how you could go and declutter, organize your refrigerator. It's more than just a home. There's digital decluttering. We're going through our phone, our emails, getting rid of what no longer serves us. And I promise you, it will trickle down into the way you think. It will trickle down into it just everything, how you go about and navigate through life. And you may even trickle down on getting rid of some people. It's been known to happen. So just stay informed. And each week we're going to go down and we're going to have a framework on how we are going to declutter our living space as well as mental space. Thank you, Rochelle, for accepting the challenge. You love clean and clear spaces. I do too, but I'm not always up on it. I'm going to be transparent. But I know one thing. If some of you who saw a month ago when I decluttered just items in my condo, I had for years. It no longer served me. And when I came back upstairs, it felt like the world had opened. It literally felt like my mind has opened up. And I always likened it to a funnel. Now that the creative process is starting, it feels like an upside down funnel, and everything is just coming in. And so that I can be transparent some more. I'm having this block, and it's here and it's here. I committed to myself in the next 48 hours that I am going to get rid of stuff. I'm looking in my condo now. I'm just getting rid of tangible items because I need this block to become unblocked so I can be the best me that I can be. We'll go over that later. We're going to end this segment talking about exercise. If you are scared to go into the gym and you love spin classes like I do, and if you want to support a Black-owned spin company, I want you to Google Git, G-I-T, this work. Somebody who knows Eddie Lemon, he is the founder of it, of his business. I want you to put his website in the comments. I don't have time to do it right now, but you don't have to go to Peloton. You can do it with someone that looks just like you, just as melanated like you. And he has spin classes that he does. He has packages. If you go on his website, you can see all of that. So, we need to keep our physical and mind together, but there's always resources. So use that resource. With that being said, I love you all. Thank you for hanging in there with me for this hour of power. Check back. Thank you, Rochelle, for putting Ed's info in. Thank you. And Ed also showed up and put in the easier way, which is on Instagram. And you can look him up there as well. Support Black business. Period. He doesn't supply the bike, but he can supply the sweat for you. So that being said, come back, tune in. We're keeping up with the physical part of getting your shift together. Thursday, I have Jamie the Motivator. He is coming on. He has been my personal trainer. And what I love about him is that he has a twist to his teaching, his training. He's a mindfulness personal trainer. It's lovely. And I want you to tune in Friday. We have the therapist, Sarita. She's coming in, and we're getting you all, particularly the ladies, we're getting you set up for Valentine's Day, okay? So this is for the ladies who you either don't have a man, no judgment, or if he's emotionally unavailable, or he wants to see you on February 15th. And if you're feeling lonely, I'm not telling you not to go see him, but just know that is some toxic D. And that's what Sarita is going to talk to us about, that toxic D, which is the toxic drug of choice, especially around this time of year of February and Love Month and all of that. But you'll have to tune in. I've talked enough. I love you all. Take care, stay safe, and wear a mask, okay? I want to get out of timeout.